The thing about medicine is it's so hard to get help when you need it. Because if someone finds out that you have mental illness or maybe a substance abuse problem, if they're not trustworthy, then they could really damage you. They can report you to the board and you get the PHP involved, and versus being able to go somewhere and say, I need help, but I don't want this to affect my career.
Welcome to the Licensed to Live show, where professionals, doctors, champions, VIPs, attorneys, and those in public office discover strategies that help you restart and gain what is lost when you find yourself accused. If another has doubted your integrity, questioned your credentials, or caused your actions to come under scrutiny, you are in the right place. On the other hand, if you have never felt the knot in the pit of your stomach when legal papers are served, the heartbreak of disappointing your family when the lock clicks shut on handcuffs, or had to appear before a board of review, then be aware, the longer you serve, the more likely you are to find yourself under the microscope of those who judge. Prepare yourself for this uncomfortable possibility. Now, here's your host, Dr. Jarrett Patton.
Welcome to this episode of Licensed to Live. My name is Dr. Jarrett, and I am your host for our journey together today and every day you choose to listen to this show. If you or anyone you know has been dissed by the healthcare system, please invite them to join us along this journey. Just go to Apple Podcasts, Google Podcasts, Stitcher, or anywhere you get podcasts and subscribe to the Licensed to Live show. While you are there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career and life changes. When I say dissed, I mean disengaged, like, this medicine thing is not what it's cracked up to be. Too much paperwork, too many administrators telling me what to do, or I don't even have enough time with my patients. Dissatisfied, like, I feel like I'm living up to my full potential and this career just isn't fulfilling. Disgruntled, like, being a doctor has taken too much of my life away. I am in debt up to my eyeballs, and I am upset because my work life is too full and my real life is left barren. Or disenfranchised, like I was when I had my medical license temporarily suspended. This show is not for those physicians who are happy and fulfilled in their clinical career, who have never had a setback in life. If you are in this category, you should definitely tell a friend to listen to this podcast. Today, we'll be talking with Dr. Centrell Crawford, a psychiatrist, a best-selling author, a fellow podcaster, mindset coach, and an addiction coach. We will discuss implications of addiction in medicine and how it could affect your career. Before we get started, I would like to let you know about a special opportunity coming up. I've gotten so much feedback on the podcast that I am offering a webinar coming very soon. So many people feel trapped in their current careers and are afraid to break out and live their true destiny. This live masterclass will give you 5 strategies to get your career refreshed and restarted despite your limitations, past failures, and unforeseen circumstances. Take your life back now and register for this masterclass at restartwebinar.com. That's restartwebinar.com. Welcome to License to Live, Dr. Centrell. I'm so happy to have you on the show to discuss this important topic that affects people of all walks of life, including high-level professionals and physicians. Well, before we get into the meat of our discussion, I noticed that while reviewing your profile, you too are a fellow graduate of Xavier University of Louisiana. XU!
XU. Yes, I went to Xavier. I'm actually from New Orleans, so I did most of my education and training in New Orleans, except when I went to residency in Houston, but it wasn't too far away. It's just a 6-hour drive. So I never been too far from home, obviously.
Well, that's great.
Except when I lived in Pennsylvania. That was a whole nother conversation.
Well, New Orleans is one of my favorite places in the U.S. for sure. It's a great place, great people, great culture there. So I understand why you stayed nearby. But you have
great food.
The great food. Can't go wrong anywhere there. You really can't. Tell us what led you through and into psychiatry.
Credentials verified.
So I went to med school to either be a pathologist or a surgeon because it's actually interesting. My aunt's an embalmer, so the only thing I've actually knew about medicine was when we went to the morgue. But when I got to histology, I hated the microscope, and I liked anatomy. I liked cutting. I didn't want to deal with dead bodies all day. So then surgery became my choice. After I realized surgeons have a really bad lifestyle. I mean, I think on average they do maybe 80 hours a week, and that's like minimum. And also, I didn't know if I would get the connection that I get in psychiatry with my patients, because I really do like hearing stories and being able to connect fully with my patients and be involved even with their psychosocial issues, and to calm them in the day to day. And surgeons, you have a problem, you have like let's say if you had appendicitis, you go get treated, you get it cut out, you go to some follow-up care, but then they're out of your life. They're on to the next case. But with psychiatry, it's more of a initial eval, a follow-up, and we're going through the patient's recovery together. And that usually extends from 3 months to a year. So I like the long-term impact that I have on a person's life and actually learning them and their story and possibly their families and really being involved in their life. So that's why I picked psychiatry. And it hasn't failed. I love that part of psychiatry. And I think I just keep growing and getting better with it.
I think that goes right along with addiction medicine as well, because what you seem to like is that long and ongoing relationship that you have to have. And all too often, people forget that addiction is also a chronic illness as well. So what specifically brought you to your interest in addiction medicine?
Initially, I really wasn't interested in addiction in residency. We actually had a unit, that acute addiction unit, more like detox unit in my residency, but I felt as if, it was really like a pre-contemplation type people. They were only there because they were sick. I didn't really get into addiction until third year, when I did more of a outpatient setting where the people were coming for help. Actually, I did outpatient, and that was more like alcohol and drugs. And then also I did a Suboxone clinic, which is maintenance, medication-assisted therapy. And I saw a different range of people. Not only did I see the people who were like, the typical quote-unquote addict, the one who's hit rock bottom, unemployed, homeless, but I also was working with people who were a little bit more up on the totem pole. They're employed, gainfully employed, they had families, they had a lot to lose. So that dealing with that spectrum of people made me realize that, not only does it affect the people who I will see homeless and not working, but also it affects people who may be just like me. And being that also, I wasn't that far from falling into that situation myself. So I think that's what made me soften up my take on addiction and my approach to addiction, because I realized that people, just like with diabetes or any other chronic disease, like if a person came in with diabetes and they were struggling, I wouldn't just cut them off and say, oh, they're just an addict, or they're just a diabetic. I would try to help them understand that their disease will kill them and go through the steps to try to get them to take their medicine, try to get them to change their lifestyle. And that's the similar approach that we should take with addiction, since it's also been proven to be a chronic disease and lifelong. How many people, if a person came into the ER with diabetic ketoacidosis or HONC, or however you say that, I'm so removed from internal medicine, would we turn them away and say, oh, you're just a diabetic and you didn't take your medicine? We will stabilize them. If they took their medicine or not after they left, we would still stabilize them. And if they came back a year later or even 3 months later with the same issue, we will still take the same approach, because we will take them as, having a disease not understanding the disease, not understanding the severity. So that's the same thing with addiction. A person comes in drunk, intoxicated. We get them stable in the ER. Also, we should give them resources or possibly hospitalize them in a psychiatric center if they are wanting to do that versus just, kicking them out saying, oh, that's just another alcoholic blocking up my ER. So we should just have more compassion, because we're doctors.
And compassion is exactly what needs to happen, because so often we as a profession can be very judgmental towards our patients, and that sometimes creates biases and blind spots in our treatment plans with our patients. And I think addiction is one of those illnesses that we tend to be overly judgmental with.
It's so weird because we're human as well. How many doctors smoke? How many doctors are obese? How many doctors do not exercise daily? How many doctors are eating donuts like 5 times a day and drinking 20 cups of coffee? We're also not taking care of ourselves. But when we have a patient in front of us, we can't do the compassion, empathy thing and write them off. But when we look at our own lives, and actually I do work with doctors, I do have doctors as clients, they have the same issues as the homeless people that come to me. They just have more money. So it's interesting.
No, I agree with you completely. You're absolutely right. Addiction is a tremendous problem in the U.S. And I even wrote a blog recently on drjarrett.com specifically about the opioid crisis after I had to come in and rush to help someone who had overdosed in the alley near the parking lot at the hospital I was working at the time. So it's not only is it a terrible epidemic in the general population, because that would include, everybody, even your homeless, but it also includes physicians and other professionals that are affected by this chronic disease. So how do you see the problem as it affects physicians, perhaps impaired physicians?
Well, I think when people think about impaired physicians, they don't realize that it actually could be anything. It's not just alcohol and drugs. It's chronic illnesses like if you have MS, or also if you have complications for diabetes, you can get labeled impaired. Or if you have some type of sexual indiscretion that relates to patients or even staff members. I mean, it's a gamut of everything. The opiate addiction as it relates to physicians, well, there's 2 things. Physicians are affected by the opiate epidemic, obviously, in a lot of ways, not just 2. First, they're kind of getting blamed for it, that they're overprescribing medication, pain meds to their patient. Secondly, they can also be facing an addiction, like some nurses and doctors who are exposed to the opiates are sometimes they can fall prey to taking the substance themselves inappropriately, stealing from the hospital, or writing their own prescriptions. Thirdly, they can help patients recover from the opiate epidemic or even any other drug or alcohol use by being willing to either be responsible for their pain management or teaching them alternative methods to pain meds. Secondly, they can also be willing to prescribe Suboxone or Subutex, or even be willing to have some type of program or education towards how to get people to the right place to get their treatment, rather if they believe in Suboxone therapy or not. And also knowing the resources in their community for drug and alcohol. Each physician could know that. A surgeon can know that. A surgeon should know that, because most times that's where people initiate pain. So those are the ways I think physicians are responsible and can be helpful in epidemic. First, being responsible for their prescription writing. Secondly, if they have a problem, seeking help. Third, be able to be a resource for your patients who are suffering from drug and alcohol abuse.
Absolutely. You have to be a resource for your patients. And if you personally cannot take care of them, you should certainly know somebody that can take care of them that will help, because at the very least, I think, the way these can affect physicians and other professionals personally is that it affects their credibility. And the credibility, it can be damaged tremendously if there are accusations of one being using on the job, or perhaps partied a little bit too much the night before and aren't in the right shape to be doing their daily duties. It really affects their credibility as a physician.
The thing about medicine is it's so hard to get help when you need it, because if someone finds out that you have mental illness or maybe a substance abuse problem, if they're not trustworthy, then they could really damage you. They can report you to the board and you get the PHP involved, and versus being able to go somewhere and say, I need help, but I don't want this to affect my career. And once you put that label on you, people start judging you. And it's such a bad situation to be in when you have to get the medical board involved, because they're a scary entity in general. And also when you have to have, if you do have impairment or labeled as an impaired physician and they want to protect the public, whatever that truly means, then they put you somewhere or put you under a contract for 5 years, 10 years or whatever, that can really just be a burden. But it says that it's going to help you. If I always have to think about every day, my license is going to be in if I do something wrong, such as relapse, then I think it'll be a very stressful situation.
Absolutely, because the boards are in place to make decisions, and often they don't have all the information they need at the time when they make a decision. So they err on the side of saying that someone could be a danger to themselves or to the public and may take an action until they can get everything straightened out. So that alone would be an ultimate assassination on the credibility of anyone, because that's something they have to answer to for the rest of their career. And not only is credibility a major topic in License to Live, a primer to rebuilding your life after your career is shattered, it's also a topic in the Career Restart Masterclass. In this upcoming webinar, we discuss ways in which you can repair your credibility that you once had. Plus, you will learn 5 strategies to restart and refresh your career. Be sure to register now at restartwebinar.com. Now, one thing that I often ask to a lot of my guests, Dr. Centrell, is have you ever been dissed in your medical career?
Oh, no, not another test.
I looked at your definitions, or I heard your definitions for this. Well, of course, I mean, when I came into medicine, I had I will be with my patients 24/7, helping them, healing them. And now with the age of electronic medical records and defensive medicine, because we're so worried about losing our license or being sued, that just the amount of paperwork it takes to admit a patient, discharge a patient. I mean, I just worked in a facility. It took, just to get a person in the door, quote unquote stable or just seen, it was 3 documents. I mean, and that was just from me. And everyone else, literally the whole staff, had like 2 to 3 documents to write. I mean, by the time the patient got out of the hospital, it was like 100 notes. And I'm a psychiatrist. I mean, length of stay is 7 days. I mean, if you write 100 notes for
oh man,
it was just crazy. And then and the bad part is, like, if it was a patient who didn't really need to be there for any more than a 3-day stay, it kind of made you just mad. Like, I had to admit this person, I had to write all these notes, and now I'm turning around and just discharging them because, oh my God. Anyway, so too much paperwork, too much administration. We don't even talk about the administrative nightmare bureaucracy at that location. And I felt like, I was just sitting at the screen. I really like to engage my patients, but when I had that mountain of paperwork, I found myself typing the screen and like trying to figure out how to look at the person. And some people be like, "Are you even going to look at me?" Well, maybe. I might. I may not. Are you white or black? I mean, hopefully, whatever. Are you a woman or female? I think that's our hair when I introduce myself.
Oh, no. Judgment.
As far as dissatisfied goes, I just think there's more I can do. I love one-on-one with patients, but I've been on this kick for the last 2 years that I want to do one-on-many. And that's why I have the Urge Fix book. I started my Urge Fix podcast because I want to reach a broader audience, hopefully to reduce stigma for mental illness, reduce the stigma of addiction, and to just have people know that, there is a way to treat your addiction, and also have for people who have one, and also for family members or people in the general public to know that there are people who want help and can recover. So I just think there's more that we can do as physicians to help with the stigma, help with the limited resources that our patients are having to deal with, especially when it comes to addiction. I just think there's more we could do. So that's how I feel like I can help with the communities that I work in, and live in. As far as disgruntled, I'm $500,000 in debt. And that's actually just when I stopped thinking about the interest that's occurring. So, I mean, Jesus, if I would have known what I know now, I would have went to state school, first of all. That would have been the case, because does it even matter if you went to private or state as long as you get the degree? I mean, the difference is that even if you go to Harvard, the salary of a Harvard-trained physician versus me, Tulane-trained physician, as a psychiatrist first going out, well, we got paid the same thing because I actually worked with a Harvard grad. We have the same pay. I actually may make more because I have other ventures. Just think about that. I mean, we gave our life to medicine. I mean, we are, quote unquote, behind the eight ball in multiple ways. I have friends who started investing or started retirement accounts at 21. I started my retirement account at 30. I mean, that's 9 whole years.
That makes a difference.
And I'm still in debt. So, I mean, I just met a physician just like maybe an hour or two ago, and he told me he was retired. He looks really young. And I was like, how old are you? He's like 47. I was like, really? I can't wait to talk to him, because I'm like, how did you retire at 47? Because the physicians I've been running into are 66 and acting like they don't have retirement in sight.
Yeah, it can be tough out there. And thank you for sharing that, because it really, and especially as you explain, being dissed on multiple levels are there. And I would like to congratulate you on your best-selling book. You mentioned that, the Urge Fix Recovery Guide. Tell us more what inspired you to write this book.
The Comeback.
Well, as I said, I just really want to try to reduce the stigma, as well as the Urge Fix book is actually written for people who are struggling with addiction, and is to help them know that they can have a strategy to recover. So I talked about the disease of addiction, the process of recovery, also the things that will harm them if they don't correct with their addiction, like blaming other people, continuing to lie, continuing to not admit to themselves that they have a problem, and also to realize that there is a life outside of using drugs or alcohol that they can enjoy, because so many people say, I'm bored, I'm lonely, or I had a bad childhood. Well, each day we wake up, we can relive, we can recreate our day. We don't always have to look in the past, because why bring your bad childhood or some bad event into your present? You got to live in the present and move forward. So that's what the book's about. Learning that I'm not saying that your trauma is not real. I'm not saying that things that you dealt with in your childhood is not real. I'm not saying that life doesn't get boring. What I'm saying is that you don't have to run to drugs and alcohol to escape those things. You just have to face them so that you can move forward and actually live a life. People are dying of overdoses at 21, 25, 35. Is that really you want to die at 35? Because that's what drugs and alcohol will do.
Licensed to Live.
I met a guy, 35 actually, end-stage liver failure because of his alcoholism. I have patients who've overdosed, and it's like, oh, it's a part of taking drugs. I had a family friend who's in his 40s, just had open heart surgery because of his cocaine use. Those are the things that are realities when you're dealing with drugs and alcohol. My book is to help you realize that you can live, you can recover, and there are things you can do. So that's my motivation for my book. My next book is actually going to deal with more of a people dealing with themselves and understanding that in reality, you're not lying to your family, you're lying to yourself. But I'm not going to go too much into that. It's actually going to be a parody. And I should have that released by the end of the year. So it's actually going to, I'd have the title. So it's actually going to be Urge Fix Expert Addict, How to Become an Expert Addict. It's a parody.
Wow, that sounds very interesting. So already with the follow-up book, I love it. Well, thank you for that explanation. So I guess for our listeners out there, what advice do you have for those that are seeking recovery or struggling with recovery?
You have to decide within yourself that you want help. Admit to yourself that you have a problem and that you need help. And then go to your family members or go to a doctor or go to whoever you can who's not going to lead you into drug and alcohol and ask for help, because there is help out there. Sometimes the resources are limited, but if you put effort in, people will help you recover. You can also buy my book, but more importantly, depending on where you are, if it's alcohol or benzos or opiates, you really do need to go to a detox, go through a detox and treatment. So go to your local ER, try to get into a psychiatric facility, and then start the recovery process. Go to rehab. There's inpatient treatment. There's outpatient treatment. There's intensive outpatient treatment. There's NA. There's AA. There is so many resources for you out there to recover. You just have to start the first step by admitting to yourself that you have a problem and that you want help.
Wow. Admitting you have a problem and asking for help is excellent advice. So anyone out there, I will have all of the information about the Urge Fix Recovery Guide, Dr. Centrell, and links to AA, NA, and a number of other resources in the show notes if you need to reach out and get some help. So I will thank you tremendously, Dr. Centrell, for being on the show today. You really have given us a bigger depth of knowledge regarding addiction and how it can affect us as professionals as well. So thank you for being on the show today.
Oh, you're welcome. Another thing I wanted to tell your audience is right now, this month, November, I'm having daily podcast episodes. If you go to my podcast at any podcasting, I call it Podcast Dealer, Apple Podcasts, Google Podcast Player, whatever, Stitcher, you can find the Urge Fix by Dr. Centrell. Also, you can go to www.urgefix30and30.com and we can connect. And I'm on all social media at Dr. Centrell Psych, and you can follow with the 30 and 30 and learn about addiction and recovery.
That is great. I will put links to all of those things in the show notes because I think these are great resources for all of us out there. So thanks again for being on the show, Dr. Centrell. We have yet another excellent episode of Licensed to Live. And remember, fire starters, if you or anyone you know has been disengaged, dissatisfied, disgruntled, or disenfranchised with healthcare, please invite them to join us along this journey. Simply go to your favorite podcast distributor and subscribe to Licensed to Live. Also, subscribe to the Urge Fix. And while you are there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career challenges and life changes. And don't forget to sign up for the free Career Restart webinar at restartwebinar.com. See you next time.
No matter how disheartening the moment of accusation sounds, how deep the pain of immobilization stabs, or how bleak your future looks, no one can take away your license to live. Keep Dr. Jarrett's expertise handy and unlock your future. Go to Apple Podcasts, Google Podcasts, or another podcast player and subscribe right now to Licensed to Live. See you next time.